were on a family planning method and it is taking you so long to conceive, what is happening? How long do you have to wait in order to get pregnant after using a contraceptive method? So today's video we're going to be talking how long it takes after using a contraceptive method for you to get pregnant, and does contraceptive methods cause infertility? So we are answering all that on this video, so let's go straight into it today. Hello everyone, you're welcome to Talk Pregnancy with Dr. Nuella. Here we tell you all about pregnancy and other women related health issues. So if you're new to our channel, click the subscription button and also the notification button so that you're going to receive weekly advice on pregnancy and women health issues. To those who have subscribed, thank you very much. I love you. Today is a very important topic. How long does it take for a woman to get pregnant after using a contraceptive method? There are various types of contraceptive methods. A lot of women have been asking me these questions. They have asked, after 3 years they use the contraceptive method and they are not pregnant, what is happening? Now, what are these contraceptive methods? First, we're going to start from the simplest. These contraceptive methods are divided into non-hormonal and hormonal contraceptive methods, and most of the problem comes in when you're using the hormonal methods. With the non-hormonal methods, the first we'll be talking about the condom. The condom is a contraceptive method, and it is also one of the contraceptive methods that will prevent you from both sexually transmitted infections, HIV and AIDS, and also prevent you from getting pregnant. We have the male condoms and the female condoms. For those who don't know, the female condom, once it is used properly, it prevents you from both pregnancy and sexually transmitted infections. So once you remove a condom, it is just used down. It has no effect on the body. So once you remove it, the next time as you ovulate in the next month, you can get pregnant immediately. The other contraceptive methods, the femicide, the diaphragm, these are also methods which after you use them, they're just very simple. As you put them, you use them, the spermicide just kill the sperms at the vagina, so it has no effect on the woman. In this case, after using this, the next time you conceive. The intrauterine device, this is what we call IUD. We have the copper IUD. This one, it is non-hormonal. It has nothing to do with hormones in the body. So intrauterine device, how is it? It is inserted through the vagina into the uterus, and once it is placed in the uterus, what does it do? It prevents sperms from coming up and meeting the egg, and also it has an effect on the inner lining of the uterus, preventing implantation. And one of the myths of this intrauterine device is that it causes miscarriages. No, it does not cause any miscarriage. Once it is used, as you remove it, even the next month you ovulate, so it has no effect on you getting pregnant. The intrauterine device can stay in you even up to 5 years. Now we go to the hormonal contraceptive methods. This is where the problem comes in. We say hormonal contraceptive methods. What happens? Normally in the body we have our normal hormones which are being produced in the body, and it has its regularity. But once you bring an external hormone that replaces the normal hormones in your body, so they have different effects on your body. How long can it take for you to get pregnant? There are 3 main things that is going to be considered. What type of hormonal contraceptive methods are you using? How long do you use it? And misuse of these contraceptive methods. These are the 3 things that will affect fertility or not. Now, with the hormonal contraceptive methods, we'll start with the emergency contraceptive methods. From the name, it is used in an emergency situation. And what is these emergency situations? I made a video on how or when you can use these emergency contraceptive methods and the various types. So after this, do well to go and check on how to properly use it, because misuse of these emergency contraceptive methods is the first thing that can cause difficulties to conceive after using it. Normally, when it is used once in an emergency situation, in case of sexual violence, in case of misuse of another contraceptive method like the pill, or maybe a burst in a condom, this is when you can use it. And there are other situations. So once you use it and be able to get pregnant immediately after using this, 1 month after, you should ovulate. But if you use it today, tomorrow you use it, the next day you use it, in a place where you have to take 1, you take 3, so that you should be sure that you should not get pregnant. The next month you do the same thing. Some women even use this as their normal method of contraception, but I said it is for emergencies. So once you misuse, this is when the quantity of these hormones is going to increase in your system, thus affecting the normal circulation of the other hormones in your body. So this, after using if you misuse this, it can affect fertility. The other method, we talk of the combined oral contraceptive pills. So take these pills daily and at the same time. So if you take these contraceptive methods for a long period of time, after stopping it, you have around 1 to 3 months. Most women get pregnant. Sometimes it can go even to 6 months, they get pregnant. But if you don't get pregnant after 1 year, you should start checking what the other problem is. This combined oral contraceptive methods, in fact, women who even miss one of the pills can get pregnant immediately. The implant, this is what we call Jadel, most of the times is your plan. It is inserted into the inner arm, just beneath the skin. So it is very light in such a way that you can even touch it. Once it is inserted, it's just beneath the skin. So once it is inserted, it can stay there for like 3 years. It contains these hormones which helps to prevent ovulation. It thickens the cervical mucus to prevent sperms from reaching the ovulated egg. So once it is being removed, fertility comes back immediately. 1 to 3 months, you should get pregnant. And even 6 months, some majority of women within 1 year should get pregnant. We go to the injectable contraceptive method. That is what we call the Depo-Provera. What is there? It's a progesterone only contraceptive method. And what happens is that it is given into the muscle of the deltoid. That's IM injection. So it is given every after 3 months. And how does this work? It actually suppresses ovulation. So this is the one contraceptive method that have a harder chance of you getting pregnant after using this method. In fact, it takes about 10 months, even 18 months, that's 1 year, 6 months, 1.5 years before you can get pregnant. So this is one of the contraceptive methods that if any woman who is planning to get pregnant even after 1 year, most of the times we don't advise you to be on these contraceptive methods because of the length of time it takes for you to regain the state which you were before taking contraceptive methods. So this is where one of contraceptive methods which has the higher chance of you having difficulties to conceive after using. The question now goes, can contraceptive methods cause infertility? It cannot actually cause infertility. It can delay fertility, but cannot actually cause infertility. That is why in most women, after you have used a contraceptive method and you have stayed up to 1 year, it is very important you go and consult. It could be other causes, because once you're using these contraceptive methods, especially if it is not the barrier methods, first, you can get infected if you are not protecting yourself from sexually transmitted infections. If your brain are having multiple partners, definitely you can have other causes of infertility. So contraceptive methods don't actually cause infertility, they can delay infertility. So at the end, contraceptive methods are still very, very important. You go to the hospital, they tell you the side effects of all the other ones, and you make your choice on which contraceptive methods to use. Thank you very much. If this was helpful, give a thumbs up to our video, and if you want us to discuss about anything, please drop it on the comment section such that we can even make a video on that comment. So if you want to have a private consultation with me, you can click on the link below, and don't forget to subscribe. Follow us on all social media platforms. We are here for you. God bless you.